Hello, my name is Spencer Warren, and I'm going to be talking about the cancer-fighting effects of a plant called Boswellia serrata. My target audience are cancer patients or those who have loved ones with cancer. So Boswellia serrata comes from India. It is used as a medicinal herb in the ancient Hindu art of medicine called Ayurveda. This form of alternative medicine has been dated all the way back to 5000 BCE, or before Common Era. In this practice, traditionally, the Boswellia plant is used for inflammation, asthma, arthritis, colitis, coughs, menstrual cramps, snake bites. The resin of Boswellia, or the sap squeezed from it, like how you get amber from a tree, along with a few other species of Boswellia, is how you get frankincense, which is a more common term for it that some of you may have heard of. Frankincense dates all the way back to 1458 BC. It's mentioned in the Hebrew Bible. It was used by the Jews, the Greeks, the Romans. The Old Testament even mentions it as it was an offering to the infant Jesus. So, needless to say, it's been around for quite a long time. More recently, it has gained attention in Western medicine because of all of its purported uses. They started testing it for other remedies because there are mentions of it killing cancer cells. And as Western medicine and its practices go, there must be several studies done to prove anything of such a claim. And this is the attention that I would like to bring to it. Let's face it, we all know someone with cancer who has had cancer or who has been affected by cancer in some way. That's just the misfortune that we face today. And so as I speak, feel free to keep that person in mind. I know personally at least 4 people who have had some sort of cancerous tumor or tumors, and unfortunately not all of them have made it. And having said that, I bet that most people, if given the unfortunate diagnosis of cancer, wouldn't think twice about their treatment. We are taught that you have 3 options most of the time that you need in combination. They are surgery, chemotherapy, and radiation. But what if I told you that this plant could be just as powerful as all 3? So I came across this one specific study that really blew me away. Hepatocellular carcinoma is a very serious liver cancer because there's nothing in its early stages that the medical professionals can detect. So by the time that it is detected, it's pretty advanced. And if surgery is not a viable option, then it's essentially a death sentence. And so because of that, and because researchers knew about Boswellia and its positive effects of other types of cancers, they decided to test it on this type of liver cancer in combination with a common chemotherapy drug that is used for this cancer. That drug is called doxorubicin. When it is used as the only drug for this cancer, it has a less than 20% response rating. It also has detrimental side effects on normal liver tissue and other vital organs. The results showed that the combination therapy of Boswellia serrata and the doxorubicin proved to be the best in killing cancer cells. The Boswellia killed these cancer cells on its own, but in combination with the drug, they killed even more. Doxorubicin is so harsh on your tissues, though, that researchers tested Boswellia serrata effects on rats who were treated with just the drug. Boswellia increased their liver functions and it reversed all damage done to the liver from the chemotherapy. So here we have this plant that not only partners well with chemotherapy, basically forming this cancer cell ass-kicking army, but it also reverses the damage to tissues that chemotherapy did all on its own. I mean, amazing, right? So I know you're probably thinking, oh my God, why haven't I heard of this? Why isn't this offered more? Why isn't this not a more common treatment option? And the answer is because we live in the West, and Western medicine dictates that it may be unsafe, ineffective, maybe not given enough evidence, and also medical doctors do not benefit from it as it is not medicine. So not only do they know nothing about it, but they won't get a paycheck from it should their patients choose to use it as their treatment. Now, I acknowledge that not all doctors are like that, and there is truth that more studies should be done on it. However, more studies always need to be done to prove anything, especially if such a claim, because that's the model we follow, and that's fine. That's the way that it should be. And that brings me to my next topic, is that the research that is being done on it is showing that there are no harsh side effects like chemotherapy, the side effects from chemotherapy, but there also are no credited recommendations for doses. However, if you want to try it, all you have to do is go on Amazon and buy capsules. You can buy the essential oil frankincense, or you can go to India and pick the leaves yourself. Personally, I have plenty of issues for which I've used this for, and it helps, but I'm just one person and I only have time to talk about one study. So if you're curious, if you have cancer, if you know someone who has cancer, then talk to your doctor about it. If they give you a weird face and advise against it, then maybe get a second opinion from someone who may know more about it, like a naturopathic doctor or maybe another kind of oncologist. And look it up, do the research yourself. There's no harm in that. If you get cancer, if someone gets cancer, chances are you are willing to invest in an alternative therapy that you can even add into your existing one because it's cheap. The research demonstrates its effectiveness. There are no reported side effects like chemotherapy, and it's completely natural. Anyone can be skeptical of it, and rightfully so. It's, different. But it's been around being used as a medicine long before Western medicine could even deem that it was unworthy of our attention for whatever reason. Do you still have that person in mind? I know I do. My aunt very, very recently died of brain cancer, and she was originally diagnosed with breast cancer, which she beat, but it traveled to her brain before her doctors could catch it. And I wonder every day if I could have helped her with this information that I now know, but I now will never know. So think about it. It may not be as crazy as we think.